start.
Dear viewers, once again we are here for a second time, part 2 of the dehydration. So we thank God so much for bringing us here. And I believe that you have tuned in, and those who are planning to tune in, may God bless you abundantly. We are here once again on this date. We want to talk about dehydration, part 2. And Dr. talked about dehydration last time, and today he added something, dehydration complications. So there are several questions. I believe Dr. Hillary has several questions for the doctor. The doctor is also prepared here. And your questions to come, the number is 0721834024. My name is Michael Sidika. Now, before we begin, or before I introduce my panelists, I would like to just offer a word of prayer, and then I welcome them. Now, let's believe and pray. Lord of Lords and King of Kings, we thank you, we praise you, and we glorify thy name. In the Garden of Eden, you gave us water. That means that you did not want us to dehydrate, but you want us to hydrate. When the children of Israelites were traveling in the wilderness, they cried for water. And so, Lord, I pray in a special way, as we are going to have Doctor here going to speak about dehydration and its complications, and we are going
will come about both in the external organs and also in the internal organs. Sit back and let's all be blessed as we talk about complications of dehydration. Thank you.
Wow. Thank you so much, Dr. for that wonderful introduction. I believe it's going to be a blessing. Dr. Hillary Wasau, it's a time to introduce yourself.
Thank you so much, Brother Mike. I'm Hillary Jackson Wasau. I also like to be referred as Wasau or Mtumishi. I want to take this opportunity back, relax, and ask questions. Sit back, relax, and ask questions. Thank you.
Wonderful. Sit back, relax,
And ask questions.
and ask questions as you listen. Oh, thank you. So, the number, you can text, you can WhatsApp, and as well you can use the chat box to ask and to contribute. 0721-83-40-24. Thank you so much. Also YouTube, we are there. And also the Facebook, we are also there. Go to Facebook, RBF Media TV. RBF Media TV. You can as well watch from Facebook. Now, without much wasting time, allow me now to welcome you. Dr. Hillary. Now, you can begin the topic. Thank you so much.
Thank you. Daktari, last time we left at a point where, and you have just mentioned actually in your introduction, that a larger percentage of the human body is made up of water. You made a very interesting statement last time about God creating the world and placing a large surface amount of water also. And the interesting thing is that you mentioned 3% of the 70% of water coverage of the world is made up of fresh water.
Yeah.
Now, there's this interesting thing about drinking water. We have been talking about dehydration, talking about drinking enough water, and today there are so many questions we want to ask so that we get to know, we get to understand what really is this dehydration. But just to start on, talking about fresh water and salt water, what is your take on that? Or what is just water?
Thank you so much. As we said last time, a large percentage of water in our world is actually salty.
Yes.
And to be precise, about 97% of water in the surface of the world is salty. So that leaves us with only 3% of water that requires to be utilized by human beings, by even crops because they use fresh water, even animals.
Yes.
And so that makes it a very vital commodity which is very rare. So the first question is to use water, fresh water with caution, don't misuse, don't waste. If you are brushing your teeth, please make sure that you turn off as you brush. When you finish, then you can continue. Water is scarce and should not be wasted. The other one, which is salty, is in mass and basically used to cleanse the world. You find the ocean may have a lot of things that are waste product, for example.
Yeah.
But because of that salt or salinity of the large surface of water, they decompose very fast and they get destroyed. So the little that remained is 3%.
Okay.
Now you pick that 3%, a human being like me, myself, about 75 kilograms. 60% of my kilogram, my weight is water.
Wow.
I require 60% of male adult weight is water. That leaves you with about 40% your bone, your muscles, flesh, and those fat and all that.
Yeah.
It is even much more interesting in female counterparts. The female body weight is, if it's 100 kilograms, then for them, 55% will be water. So only 45% will be fat, tissue, muscles, bones, and all the solid things. So water is a bigger percentage. Now it's more interesting. It becomes more interesting in children. Like if you pick an infant is like 1 year or 1 month old, on 1 year and below. That person, the weight, the water percentage in the little one is 85%. 85%. So that it means that they require water in large scale. Okay.
That brings me to a point to remind our women who have just given birth that for this 85% of water to be achieved in women, they need to do something called exclusive breastfeeding, right?
Yes.
Yeah, so that is very important our viewers to remember.
Now, maybe our viewers could ask, what is this exclusive breastfeeding?
Thank you very much. Before a baby attains 6 months of age,
Yes.
they only need to feed on breast milk.
Only.
And it is breast milk of mother, the maternal breast milk, not any other animal. Many times we have taken shortcuts and taken, cow milk or animal milk to feed the human child.
To substitute
To substitute the human milk. No, it's not safe. It is important to note that the human milk is so much, orchestrated towards the health of the little baby. And if you give, if you substitute with any other fluid, you are doing a big disservice. For example, should there be any need to substitute maybe formula milk for a short time as you correct the problem?
Yes.
Rather, the human milk is orchestrated to give the baby hormones, enzymes, all nutritional supply from that small liquid from the mother. Water in the breast milk is 90%. So 90% of breast milk is water. So as the baby breastfeeds, he or she takes water in large scale. Then the little percentage remaining is now for protein and ions. That is supplied from breast milk.
Yeah, there's an interesting fact you've mentioned, and I want it to come out clearly to our viewers. Infants, their body, 85% water. Now, you have mentioned that breast milk contains water in it, right? So when we talk about exclusive breastfeeding, some women will be tempted to again force their infants to take water. How do we go about this?
Thank you. Studies have shown that if you give the little baby exclusively supply of breast milk, you don't need to give that baby water.
Yeah.
Our biggest fear is that the safety of water that we drink is not guaranteed. The first thing is that, like, if we take this bottled water, it will have very nice label of the things it contains. Apart from H2O, we have some sodium, the pH is indicated there,
Yes.
some phosphates, we have some chloride, but it has to be measured. We are talking about a very interesting community, society, where some people may take shortcut and don't apply those things in the label to be in the water. But the human milk, God is interesting.
Sure.
He doesn't take shortcuts. When he supplies, it is the right concentration, the right temperature, the right everything, the right color. So breast milk is enough for the baby for the next 6 months. If people try that, and a study was done practically, and one of my lecturers called Dr. Mudani, she did a practical example and picked 2 ladies who had just given birth. One of them was strictly following exclusive breastfeeding, and the other one was a bit confused by the fellow women. Will the baby be satisfied? The stigma in the community, and she didn't do as per indicated. In 6 months' time, the one who had been strictly following the instruction of exclusive breastfeeding never went to the hospital for any problem.
Wow.
No common cold, no fever, no nothing. But the other one who was taking shortcuts was almost every month had diarrheal disease, a problem has occurred, fever, and all that. And so you can practice and you can test and try exclusive breastfeeding.
That is good for very interesting to note. So point to note our viewers is that while adults are drinking enough water, we are going to discuss about how many liters of water we need to drink. Kids, infants to be precise, are left to breastfeed, and it is exclusive breastfeeding. We are still urging you to send your questions to 0721 83 40 24. The number is 0721 83 40 24. Daktari, maybe there's someone who is joining us for the first time. He was not there in the first session and today he's joining us for the first time. And this person is asking, what is this dehydration these people are talking about? So maybe you just clarify, what is dehydration again? Just a recap of what we did last time.
Thank you very much. Dehydration basically refers to, a short supply of water in our body compared to what we lose. So on a daily basis, we naturally lose water from our body. This needs to be replaced also as spontaneous or as natural as possible. But when we don't replace the loss, then we have dehydration. We have less hydration status. And that is what it means.
Thank you. This brings me asking this question.
Yeah.
How many glasses of water then should someone take in a day?
Thank you so much. As we mentioned last time, we are replacing the loss. It's good to note how much are we losing in a day under natural circumstances to tell us then how much should we replace. Under normal circumstances, we mentioned that a normal human being will lose about 1 liter of water in urine. So you pass urine the whole day, should have used you have passed 1 liter of water. To some extent, it may reach even 1.5. Then, when we are talking, as we are doing now, also we are losing water very invisibly, but we are losing water. If you breathe out on your back of the hand, you feel warm. That is water vapor. So we lose water as we breathe out. we are losing about 200 mils of the same.
Does it mean those people talk a lot, lose a lot?
It's true. So it's talking, it is singing, it is crying. Every time you are voicing, you are talking, you are crying, you are expressing yourself in any way, you are losing water. So about 200 to 300 mils. Which means from 1.5 plus 300, we are at about 1.8 mils of water.
Sure.
And then when you pass stool, whether it's formed, semi-formed or loose, also it comes out with water. And in fact, if it doesn't come with water, then it will be so hard that it is injurious to the passage where it comes, where it passes. And so about 300 or so of mils of water is lost just through stool. If at all it is diarrheal disease or passing loose stool, then the amount increases so much. So 300 plus 1.8, you are talking about 2.1 already, 2.1 liters of lost. You have lost.
Yeah.
But that is not enough. When you sweat, you're also losing water. You know, if you collect sweat and you analyze, a big percentage is water, with some salt, and some, uric acid.
Yeah.
That is sweat. So as we sweat, we lose about 500 mils of water.
Wow.
So 2.1 plus 500 mils, we're talking about 2.6 we have lost before we finish our loss. The last loss is tearing. As you shed tears is just water. You're losing water at the same time. So about 200 or so, depending on how much you shed. And again, ladies are very much blessed in shedding tears.
Crying, yeah.
Yes.
Very emotional.
Very emotional. Some men also do, but not as much. So depending on the degree of emotion and how you express it, you will lose more there. We're talking about now about 2.8 to 3 liters loss, natural loss, before you get disease, before you work in, probably if you're working in a very hot environment, you lose more by sweat.
Yeah.
There is two types of sweat. One of them just profuse sweat. You see somebody sweating and the water is dropping down, but another person is just unseen, just perspiration. As the water comes in the surface of the skin, it dries very fast before somebody sees water dropping. That is water loss. So if we are losing 3 liters naturally, then it means we should aim to replace 3 liters without being forced or without, being coerced. So you can plan yourself, I'll lose naturally through the skin and through the other orifices. So let me plan to replace also without much ado. Now the best way of replacing or is planning to replace is actually traveling in water with you.
Okay.
If you are in your office, let the water be there with you.
Yes.
If you're driving your car, that's the next to you there, let the water be there. Then you will just be replacing. The best mode again is not to take 3 liters and finish in one go. No. Little by little. Spread it over the 12 hours. The best thing is to do like 1 glass per hour.
1 glass per hour. Okay.
1 hour has passed, a glass of water has gone. That is very, very interesting, and you can finish your dose without much ado.
Okay. Maybe before you ask.
Yes.
Dr. Urine is very interesting.
Yeah.
The eye has been made in a wonderful way. And water is also a lubricant. I see when how do you call them, those who repair vehicles?
Mechanics.
They use water as lubricant.
Yeah.
A coolant, air coolant. And the eye, it rotates.
Yes.
So today we are looking at the complications of dehydration. Now you lack water in the eye. What will be the complications? Because I studied something that water acts as a coolant or a lubricant to the eye.
Yes.
So what happens if you have or you are dehydrated, especially to your eye?
To your eye.
Yeah.
Thank you so much. As you mentioned, the eye is a very interesting organ in the body. One ophthalmologist who used to be an atheist, when he finished studying the eye, he surrendered to God. He said, "There's no way this must have been, it could have erupted without anybody behind it." So the reason why the eye needs water are two. One, the eyeball itself, it looks globular, round, but it's just like a balloon filled up with water. If you were to puncture it, and don't try this at home, puncture it accidentally, and that water leaks out, this eye will be flat, without anything like foam in it. So we have the eye in its form because of aqueous fluid, which is filling the inner part of the eyeball. Now the outer part, as Nick has mentioned, is also actually rotating in a lubricant. If you want to prove that, just stare with your eyes open for about 30 minutes without winking. You will feel pain.
Yeah, sure.
Because then the water in the surface will dry up. So you need to roll it to keep picking from internal and bringing out. So the eyes will, without water, will have some, some rough environment between the eyeball and the inner part of the eyelids.
Sure.
And that means there will be injury to the very small vessels that,
Very sensitive.
very sensitive to the eye.
Yeah.
But also the nerves that pick information will also be injured.
Yeah, sure.
But the biggest thing, should that aqueous reduce, then the eye will be sunken eyeball. So you will see the eyeball, the appearance, the outlook, the beauty, the handsomeness will disappear because there will be a very big hole in both two eyes. Very ugly now.
Yeah, sure.
I think.
One of the complications I've seen athletes, they run and then when they feel like they are tired, they take water. In the essence that someone does not take water, can that cause fainting?
Fainting.
In simple terms, can dehydration cause faint?
Oh yes. Yes, it can.
Okay.
And this is how it happens. When your water volume has reduced, in simple terms, we'll refer to that as hypovolemia. So you'll have hypovolemic situation. The volume in the bloodstream will drop drastically.
I believe Brother Mike is taking notes.
The level of hypovolemia.
This is not a medical school.
Yeah. So the level of blood volume will reduce drastically.
Yeah.
Because remember, over 90% of blood volume is water again.
Sure.
So should you lose water, the volume of blood goes down. Then it goes down with your blood pressure. What keeps the blood flowing in our body to supply all the organs? I liked the prayer of our brother when he was mentioning the Eden.
Yeah.
And God made Eden, and then there were streams of water in Eden. There were 4 streams. And the human body is like a garden with streams of water flowing constantly. And it's made of like paddocks. So each and every paddock, there's a stream passing this side and this side as well. Now, as the stream of water comes to the cells of the body, they release the contents that are supplying the body with the hormones, with the warmth, with the sugar, with everything the body needs. And then the other side also, the cells releases, the metabolites, the outcomes of metabolism, the excreta. So they release and they go to another stream. Also another channel for excretion through urine or through stool or through the skin, wherever.
Yeah.
Now, should you have reduced volume of the stream flowing in the body, then the cells will begin to complain, number one. And when the cell realizes the a little stream coming, the stream has been depleted, then it will send signals, as we talked about nerves, to the brain. And the brain will sense, there is little water in the cells. And the brain will dictate the mouth to become dry. You feel thirsty.
Yeah, sure.
Then when you feel thirsty, that is a sign you have been injured in the cells.
There's a lot of damage.
A lot of damage. Don't wait to be thirsty to drink water. You will be correcting injuries. And not all cells will be, not all injured cells will be corrected adequately.
Yeah, sure.
Some of them will be injured and remain damaged for life. Don't wait for thirst. For thirsty situation, just replace the water. You can faint. When you deplete, when you reduce the volume. But also you can, for athletes, apart from fainting, you may have what we call a heat injury. We mentioned about coolant. Because it's a coolant, if you deplete it, you may have heat injury. The same way our cars have radiators. And if there's no coolant in the radiator, the engine can be injured.
Yeah.
So yes, apart from fainting, you will have heat injury.
Now,
Maybe,
yes.
I'm learning a lot. Learning a lot. Like the word you say,
You just forgot.
I'll take the notes.
Okay.
Hypovolemic. Terry has talked about something very important.
Yes.
And by the way, most of the time, we wait until we become thirsty. That is when we take water. Like you see somebody is in the farm, he's digging, but this person is taking 2 hours without taking water. So the last time the Terry talked about this, and he has repeated it again, it means it's very important.
Very important.
That when you wait until you become thirsty, when you drink water, that means your body is craving for it. So there's something that needs to be corrected. Now, let's tell you this is an equation. Like the topic of today is very interesting. Now, should we drink water or should we take water? Because when we are thirsty, we take water and we drink that water like something else, we gargle in fact. So, but when I am taking water at levels, I'm not gargle because I just give it. So, should we sip the water or should we drink the water? Because, and number two, if we drink water without a stop, are there some complications? What is the right way to take the water? Is it to gargle the water or just give sips?
Thank you.
And if it is to be gargled, not to be gargled, and that's what you always do, are there some complications with that?
Good questions. Good question. Now, we drink water. We drink water. The athletes may not drink water on the go. You will see a lot of water along the field, but they're not drinking actually to quench the thirst. Just put it in the mouth a little bit and throw it away. The way we are running, should that water fill the stomach, a whole glass, then there will be twitches, there will be pins and needles in the stomach as they run and the water is shaking in the stomach.
Yeah.
But you and me who are probably sitting in the office or just doing a small slashing exercises, drink a whole glass at a time. And as we mentioned, do it every hour. What is the problem with taking like 2 liters at once so that you want to clear your dose at once? The problem is, yes, you shall have filled your stomach with water, and but you will need to be going for the short call very frequently, because as you feel, it is used and the waste should be taken to the toilet. So that will be really frequency is not very good. There is no overdose of water if you limit yourself to those liters or the amount the stomach can accommodate. But we mentioned last time that because you are also going to be eating in the course of the day, leave space for other nutrients that we need to feed our body with. And so if you fill it with 3 liters of water, you have what we call satiation. So you feel like you are full. And even full of water H2O only. But you need carbohydrates, you need proteins, you need vitamins. Yeah. So take a glass and don't take with meals. Many of us have got that habit. Of food is ready, then they sit down, water is here, and food is there. So they eat as they drink. Wrong. Two reasons why that's wrong. Because probably we are taking a fatty meal, for example, and when this fatty meal lands into the stomach, and then in a short while, cold water lands within the fatty meal also, then the fat will now be frozen, for example. And now, for it to be digested and absorbed, we require the food to be in the body temperature. So the stomach will take time to warm that food which to melt that fat for it to be appreciated by the absorbing cells so that it can go to the body tissues. Yes.
Lecturer, you talked about some people taking cold water.
Yes.
Now, what complications, okay, we are talking about drinking water and taking water. Some people will wait until they are thirsty. And then now they start hearing them ask, kuna maji kwa fridge. And then they'll request to be brewed as cold water in the fridge. What complications does this one cause in our body?
Thank you very much.
Drinking cold water.
Thank you very much. Number one, the cold water will not take sufficient. Normally, when you take a glass, you will hardly finish it.
Yeah.
The thirst shall have been quenched, but the dose which you require shall have not been attained. So, human beings are warm-blooded animals. Under normal circumstances, we have about 36.2 to 37.2 degrees Celsius, normal body temperature.
Yeah.
If it is possible, take water of that room.
Yeah.
Room temperature is 24. If you were to take the one similar to your temperature, there will be no time wasted in warming it in the stomach to bring it to normal body temperature for it now to be assimilated or absorbed by the body.
Okay.
So the temperature should be your temperature.
And now there are people who they've heard that we should be drinking water. Now someone is going to drink water, as we have seen. So next to the drinking is an excess. So what is the complication of drinking excess water?
Good news is that God made our kidneys with the ability to extract that which the body requires in terms of water.
Okay.
And preserve the loss of that which you should not lose. Should you drink excess water than you require or than you have lost that time, the kidney is very smart. It is going to allow wastage through urine. So you will just urinate a lot. So long as your kidneys are functional, even if you take 5 liters at the same time, apart from busting your abdomen, you may be eliminating it through urine very fast. Okay. So there is no much complications, but of course take with moderation.
Now, we just are about to go for break.
All right.
Dear viewers, thank you so much. We're going to have a break, and before you have a break, actually just a question to Paula as we go for break, and I know Dr. Daniel has got questions. Up to this moment, I've not received any question. Maybe they will come. It's all about the dehydration and its complications. I have a very, I don't know whether it's a very important question or not, that we'll have to ponder as we go for break. Can the color of urine determine the level of water in our bodies? Now, as we go for break, we ponder on that. Dear viewers, stay tuned. We'll be back in the next 1 to 2 minutes. God bless you. Thank you so much. Welcome back for another ongoing discussion. Daktari,
Yep.
when we were going for break, I had a question. And I just have 3 questions for you, help us. My first question was, can the color of urine determine the level of water in our bodies? Now, another question, because sometimes you go to the toilet, and you'll realize that sometimes the urine is very white, colorless. Sometimes you go to the urine and your urine is too yellow, and then it gives some foul smell. Then there's a time you go to the toilet and the urine is amber. Somehow yellow and not yellow, just somehow. So, for a healthy person, is amber. And so, can the water, level of water, determine the color of our urine?
Right.
Thank you.
Good question, viewers. Yes, it does. The best hydration status of the body will yield to just like clear urine. That urine may not be smelling a lot because much of it is water. It's good to know what's the content of urine so that you can pick the degree of waterlessness and what else is more. Urine contains urea, as many people know. Other than urea, talk about uric acid, we talk about excess salt and water. So it is the degree of the concentration of urea, or rather urea in the urine, that gives you that smell, that typical urine smell. If you go to the toilet, and most of the time you find the toilet, normally the color background is white. Should it be stained in yellowish or amber color, there is some dehydration in your body.
Okay.
The best color of urine, which is well hydrated body, is colorless.
Oh, so the urine should be colorless.
Colorless.
And not foul smell.
Not foul smelling.
Okay.
If the urine color is cola, you know the Coca-Cola color,
Yeah.
that strong tea color. Then,
So you mean there is a time that urine can have that color?
oh yes.
So that one under which condition?
Now, that is now severe dehydration, and
Okay.
also in UTI, urinary tract infection.
Okay.
So some people may have even bloody urine. If you have a state of disease called bilharzia, also your urine has been mixed with blood from the urinary bladder, or from the urethra, the pathway of urine from the bladder to the outlet, the urethra. Some people may have a stricture, narrowing of the urethra, the passage of urine from the urinary bladder to outlet, and that stricture is just made of some infection that took place in the inner tube and was not well treated, and then there was some erosion from the tissue there, and it, bled a little bit, and now there is a swelling there, like,
Okay.
a swelling. So yes, the best color is colorless.
Okay.
And should you just go and find in the toilet you have a urine which is yellowish, it is possible that you have less water in the body.
So it means that if the color is yellow, you got to hydrate.
Exactly.
Thank you,
And
sir.
sometimes yellow color may also be there because of some pus in urine.
Okay.
Pus is made of white blood cells that have been killed in the process of fight between germs and the body fighters. So white blood cells and the germs and the dead tissue, then you can have pustular mixture in urine, which is yellow. So before you conclude, then you need to test that urine. But if it just, most of the time, when the color is due to infection, there will be some pain when you're passing urine. So there will be inflammation in the passageway, and when urine is passing, there is some pain. But just color, just drink water,
Wow.
and you will be fine.
Dr. Hilary, you've had that. This is very interesting. I wish that we can plan, we go to these colleges and universities and primary and secondary, we educate people on this. My second question to you, what are some of the complications of dehydration in the kidney? You have left your body, it has been dehydrated. Now, what are more specifically, I know there are so many, there could be many other parts that might come in the second question, but now specifically on kidneys, because kidneys are very important. And so the body is dehydrated. Are there some complications in the kidney when the body is dehydrated?
Thank you very much. Oh yes, there are. And the most sensitive organ to water levels is the kidney, other than the brain.
Kindly repeat that statement.
The most sensitive organ in the body to depletion of water level is the kidney. Kidney form part of what we call the vital organs. And we're talking about the kidney, the lungs, the heart, the brain, the liver, vital organs. And so kidney, what happens to kidney when water is less? One, the nephrons, or the fine micro group of cells that help us to filter out toxins through urine, through the kidney to go to urine and be eliminated, those nephrons uses water in large scale. Should water be less, then what happens to the kidney? We're talking about the whole urine system. The organs involved, number one, are the kidneys. Then number two, the ureters, the part of the kidney that brings that urine to the urinary bladder. So all these organs making up the system called urine system will be affected. Kidney, what happens to the kidney tissue? There are parts of the kidney where filtration takes place. Should there be no water, that salt, we talk about excess salt in the body, that is making part of urine. That salt will crystallize, and the crystals will be brought together. That will give you
Dr.
Yes.
There are some very important points that you're making, but I would like you to repeat to the viewer.
Yes.
Kindly, that point of crystallization.
Thank you.
Repeat that point because it's very important.
Thank you very much. So we have salt that should be eliminated through urine.
Okay.
That takes place, and the filtration takes place in the kidneys. Should there be no water to dilute that excess salt for elimination, then the crystals of salt will come together and make stones.
Okay.
You shall have kidney stones.
Oh, that is what causes kidney stones.
Oh, yes. Yes. Then the kidney stones are very bothersome, very painful, nagging pain that never go off, and you cannot concentrate in doing anything until they are attended to. And they force themselves through the filter And when they are forcing themselves because of gravity, you cannot move because you are shaking them and you are injuring the filter in there. So you want them to be there. You need to take water. The kidneys will be very safe. Apart from the kidney stones, which then must be attended to should they grow, depending on the size. The diagnosis is basically ultrasound. So you take ultrasound, you check the kidney if there are stones. The treatment, now then you see a urologist.
Okay.
These are surgeons that takes care of our kidneys.
Wow.
They can give you medicine to dissolve those salts, or if they're too big to be dissolved, they will take you to theater, give you a small cut, and pick them out from your kidneys. Other than the kidney itself, then the ureter, the pipe that picks urine from the kidney manufacturing unit to the storage, which is called the urinary bladder. Also, those salts, those salt stones can force themselves into that ureter and blocks the flow of urine. Deadly. Now, there will be no urine coming through that ureter again. The patient will have little urine. Thank God there are two. If one blocks, the other one should be working. But the rate of urine formation will be low. What happens? If you're still alive and taking water and the urine is not formed, and the place is blocked, then there will be accumulation of urine on top of that blockage. It will be backflow to the kidneys, and that will bring you what we call hydronephrosis. There's a lot of water in the nephrons, in the kidney. They are swollen. So if you feel pain literally, or they take ultrasound, there is visible there.
Okay.
The last portion is the urinary bladder. It's just a storage tank for urine before it is convenient for you to go to the toilet. It is stored in the urinary bladder. If you are in a situation where you don't take enough urine, the same thing takes place. That urine in the bladder will be over concentrated. And the concentration means because you're not taking more water to dilute your salt in the body, the one in the bladder, the little water part of that urine will be reabsorbed back to the body, over concentrating the one in your bladder the more. Then, the more it is concentrated, the easy it will be to form crystals, to form stones, and that can give you bladder stones, urinary bladder stones. Also dangerous. Removal is just by a surgery.
Okay.
And remove the stones.
Hey, Daktari, I believe viewers are learning. Dr. Hilary, those words have left my mouth open. So you mean kidney stones can also occur just because of lack of water in the body?
Actually, that is the main cause. Because the crystals form and they clot. Those are just salts. The crystals are just salt that needs to be dissolved. So if you drink a lot of water, then obviously they will not form. So for our viewers to prevent them going to that stage of seeing a neurologist for operation, just to drink water. Just drink water and the crystals will not form and you will not suffer from kidney stones.
True. Education is power. Thank you, Daktari. This is so powerful. Now, Daktari, just to mention that my last question is, which organs of the body are mostly affected by dehydration? Just name around two. Just name. Next time, you will tell us how they are affected. Of course, we've talked about kidney. Now, give us maybe around other 2 or 3 that are highly affected. But next time, we will see on how they can be affected, and then we'll go back to Hilary to give their questions, and then we'll say goodbye.
Thank you. As a matter of priority,
The brain.
Brain is affected much when water is less, and the other one, of course, the heart. It will require enough volume to pump. So if you have less volume, then there will be less blood to pump. So if there's less volume, there's also a reduction of blood pressure. Hypotension.
There is another term. Now, Daktari,
Yeah.
I'm surprised.
Yeah.
In fact, it's now clear to me, very clear, the reason as to why God gives water.
Mhm.
And as I give my mic to Hillary,
Mhm.
I remember Ishmael
Mhm.
and Hagar
Mhm.
when they were chased from Abraham's home.
Mhm. Mhm.
She went and sat somewhere.
Mhm.
The water that she was given and the food were over.
Mhm.
Then there's a woman, because of the love she had for the child.
Mhm.
When the child was crying, she decided to leave the child, and then she went somewhere far from the child.
Mhm.
And the Bible says God called. The angel of the Lord called to Hagar from heaven.
Mhm.
And then the Lord opened Hagar's eyes, and she saw water.
Yes.
and going to this child.
Mhm.
So it means water is very important. Viewers, this is a very nice topic. Dr. Hillary, kindly, your questions, we have around 6 minutes. I know time is my spent. I don't know whether we have some questions. Now, as you ask, let me see if we have some questions. Thank you.
Daktari, last time, just when we were finishing our session, we mentioned something to do about importance of men taking enough water. What is the importance of men taking enough water? For the ladies, we are not discriminating you. We will have a session with the ladies. I think in our next session, we'll see a guy, and we will talk more about ladies. For now, what is the importance of men taking enough water? Most of those who are married.
Thank you very much. There is one organ in the body of human beings which is exclusive only to men.
Yes.
And that is the penile organ.
Yeah.
It makes the man manly. And should it fail to function, and there's a lot of problem. A bigger percentage of men who go into depression is because of that silent reason. They have entered what we call erectile dysfunction.
In simple terms, ED.
Erectile dysfunction. That organ is just flaccid, just leaves before its work is due.
Okay.
And what makes it to be a very strong and firm and very injurious is flow of water, which is blood, flow of blood into it, which is well organized, well orchestrated.
Yes.
So we allow inlet or afferent blood channels to fill the organ when the work is due. It is filled with blood. It becomes warm because you are a warm blood animal.
Yes.
A lot of blood comes there, and then the efferent or the outlet is blocked. That is done by God's way of
God miraculously.
So the efferent or the outlet of that organ is closed. The inlet only is bringing more blood.
And then now it's filled with blood.
That is firm and strong. It can do the purpose. It should be like that until the purpose. And it's not about you as a man.
Yes.
It is meant to satisfy your wife, your spouse.
Yeah.
So don't have satisfaction that you are done your part. It is her to say you are done. Many times we have a strong erection at the beginning of our act, but after some time, before they are satisfied, it is flaccid again. The strength is lost, disappointing. Many times is because our vasculature that brings blood inside that organ are not patent enough. Maybe because of the food stuff we eat. That has thought for another day. We shall discuss another day what food stuff do we need to bring us a healthy vasculature that can bring about good flow, that can sustain the task to the end. So yes, that organ to men is really suffering. Many a times people have gone for the drugs that are meant to bring you a power and bigger. Yet Water could have done it.
Actually, a research has been made, and that drug has been on demand for quite some time.
Oh, yes.
And then here we have a solution. Just take water, and you'll be fine. So viewers, you can see the importance of water. Water is life, and water is very important in our blood flows and also in our system.
True.
I think we are done. I don't have any question, but unless my brother, you have questions from our viewers.
Dr. Hillary and Dr. Ochola.
Yeah.
This is a very wonderful discussion. I know we shall continue maybe sometimes in the future. Here we have some viewers here. Before we give our parting shot, there is one by the name Gertrude Mucheyu. I guess I've read your name correctly. If I've not, then please forgive me. I see our technical team are also hydrating here so much. Hillary, do you have your water?
Yes.
Oh, you have your water. Oh, great. Doctor, you have your water?
Oh, yes.
Oh, great. Oh, yes. Now, now our technical team is telling us there are some people appreciating here. We have Gertrude. Gertrude says these words. Thank you so much, doctor. Now I understand better. Last month, my husband had kidney stones. Daktari really helped me. God bless you, doctor.
Oh.
That is from Gertrude Mucheyu. Is it Mucheyu or Mucheyu? Gertrude will forgive me, but Gertrude is really appreciating and she is listening and commenting as well. Now, I'll begin with Dr. Hillary Wasau. You can give your parting shot. Then after Dr. Hillary Wasau, we will have Dr. Ochola, and then we will close. Welcome.
Thank you so much for this opportunity, and I want to also thank you, our viewers, for spending time to come listen to this beautiful and wonderful session that we have just had. Water is very important. As you can see, it prevents a lot of diseases and a lot of complications. The likes of kidney stones, the like of erectile dysfunction, faint, and so on and so forth. We even realized last time that for our skin to be beautiful the way it is, for you to stop applying makeups, you just need to drink water so that you become, for our skin to glow, you just need to drink a lot of water.
Oh, really?
Water. Yeah. So friends, water is life. Water is very important. And what we have just learned, I said it last time and I'm saying it again, don't wait until you're thirsty to drink water. Drink water frequently. There's this thing, we will discuss it I think next time. We have said about we need to take 2 to 3 liters of water. What about those people living in areas where the temperatures are high? But that we'll discuss on our next session. Otherwise, thank you so much for having us. I have been your host, Hillary Wasau. Until next time.
Before you,
yes.
What do we have next?
Next, we have a session and a meeting with our ladies. Gents will also be allowed to come. We are going to have a gyno. We are going to discuss so many things that are affecting ladies, including their reproductive system, including their ladies have a lot of infections on the reproductive system. We are going to discuss all that, including their menstrual cycle. Yeah, so we will welcome you again. Please don't fail to come. Thank you.
Thank you so much. 3 points as parting shot. Number 1, everything in this physical body, in this physical life, has a connotation in the spiritual aspect. We mentioned last time, and we read a book in the Bible, John the Gospel, chapter 7, verses 37 to 39. It says, in the last day, that great day of the feast, Jesus stood and cried, saying, "If any man is thirsty, let him come unto me and drink." 38. He that believeth on me, as the scripture has said, out of his belly shall flow rivers of living water. We remember the story of Jesus and the Samaritan woman. Water is always mentioned in the salvation plan. Verse 39. But this he spake, or he spoke, of the Spirit, which they that believe had not received. For the Holy Ghost was not yet given, because that Jesus was not yet glorified. So water in the spiritual aspect refers to the Holy Spirit. Now, as the spiritual life requires the Holy Spirit to make sense, also in the physical aspect of life, we need water for the physical body to make sense. Point number 2, one of the complications we didn't mention because of time is seizures or convulsions. Some people may convulse and you may think they have what we call epilepsy or a convulsive disorder, but they were just reduction of water level that has deranged what we call electrolytes. Those salts we're mentioning are electrolytes, so to speak. If they are imbalanced, not balanced, somebody may go into convulsions. And this can be prevented. For example, much potassium more than normal can bring you convulsion. Reduced sodium levels can give you convulsions. And so we have to take care of our body so that the balance between water and salts is optimal. Water and electrolyte imbalance will bring you many problems, which we may not mention now. Last but not least, don't drink water with meals, drink water in between. Water should be cheap. And I want to appeal to our government, the people, public health, community leaders. Let's try and supply clean and safe water at a very affordable price. As we speak now, it is a bit expensive. If you go to the supermarket to buy 1.5 liters of water, you may part with about 60 shillings. If the brand is international, you may cost 100 shillings just for 1.5 liters. And yet you buy a bottle of soda at a less amount. So let's make water affordable and cheap. I love other countries where we have people supplying water for free, and I want to hail for the purposes of being recorded. One of our philanthropic leaders in this town of Mombasa, who could supply fresh water, bottled water, in tanks, in the estates where there are low income people, and they would queue to take water using bottles of jerry cans. And that is Mombasa Cement, the owner. May his soul rest in peace. He watered this town with clean water. May somebody pick it up and we supply fresh, clean, safe water. Water should be very affordable. Thank you very much.
Wow. Thank you so much, Dr. Hilary and Dr. Ochola. Thank you so much, viewers. We are so much grateful. We see very many of you here. We really appreciate taking your time to watch, and I believe that you're going to share widely for people to be educated, what is very important. I thank you so much, viewers. Again, we hope to see you next time. May God bless you abundantly. Those who are here, those who have watched, those who have thanks, may God bless you abundantly. I lack words, Hilary. Literally saying thanks, Mike and Wasau. Literally, thank you so much. Thank you so much. God bless you. So we can share widely. Next time, we are going to have, as he has said, gynecologist. Oh, ladies, don't miss this. Gents, don't miss this. It will be on fire. And soon and very soon, you're going to have several topics each day. I don't have much to say. Technical bench. Oh, God bless you abundantly. You people, you're great. Otherwise, all in all, thank you so much. Bye. See you next time.
Bye. Thank you.